What's up, guys? I am here today. We're going to talk about chapter 6, and I'm going to give some housekeeping stuff on the back end of this video. So make sure you stay tuned and please watch everything. So we're going to get right into chapter 6, okay, which is problems in epidemiology. All right. So we're just going to go right into it in terms of study problems, in humans. Let's go right to cohort study. Okay, what you are as a student currently, as you plan to graduate either in May of 2021 or in December of 2020, you're considered a cohort. Okay, basically, a cohort is a group of people or a group of human subjects that are studied over a period of time generally from a starting point. And for you guys who are getting ready to graduate, it was either maybe August of 2017 or maybe of August 2016. So it just depends on the start date. Okay, based on your start date, data will be collected about you until you graduate. And of course, the data is just simply GPA, major course of study, small factors as far as maybe you're a commuting student, maybe you're a student that lives on campus, maybe you're a student that might have a meal plan. So those are just little things that they analyze. But sometimes cohort studies are hard to analyze as far as health implications are concerned. So those are a little bit of the issues with the cohort study. It can be hard to break those groups up. Now, intervention study, the problem with that one is that we're grown. Okay, we don't want to follow the rules. We might just do the study for the money, but we don't want to follow the rules. Or we may not follow the protocol properly. We might forget. Something may happen where time wise you just maybe miss the mark. So we're not going to follow through. That's just human nature. Okay, we're subject to error. All right. Now, case control study problems, that's a little different, where it talks about control group may not be truly comparable or errors may exist in reporting or recalls. Basically, what that tells us is that it just lets us know that there's so much importance to make sure that your researchers are all on one accord and that your study groups are, as far as how you broke them down, that they can be compared. Okay. So all that is just a concept of making sure that everybody's on the same page. If you ever seen the movie Drumline, where with Nick Cannon, I used to have a crush on Nick Cannon, but the movie Drumline talked about one band, one sound. Well, that's the ideal goal that you want to obtain in terms of doing research and data collecting and epidemiology. You want everybody on the same page, and even your groups. Okay, you want your groups on the same page, making sure that they answered the correct study questions to be eligible in those groups, and making sure that those groups can be comparable. And what can throw it off is that maybe maybe something about that group just automatically made it non-comparable, or not comparable, rather. So those are just things to be mindful of in terms of errors. Now, when you get those errors, you'll have something that is called a bias. Okay, a bias just means that there are prejudices. Say that word 3 times. As far as maybe conducting research in the group, like maybe not even just that, but just more so, maybe you have a spouse that's participating in a study and you're the researcher. Okay. Maybe maybe as far as taking notes or maybe documenting what was going on in that particular group, maybe you missed it. So that's a recall bias. Or reporting bias, that, maybe you just, maybe you're doing some sort of interview and maybe the person that you interviewed said something that just really got underneath your skin and you documented something different, but you're not documenting facts from the research. You're kind of documenting your own insight on what's going on. So those are a little bit of reporting and recall biases. Okay. Confounding variables. It's basically having one variable, as I show you my nailless finger, but confounding variables are basically variables that will change the result of another variable. Okay, so oftentimes, or rather impact or influence another variable. So that's what really confounding variables are. Sometimes we think that, okay, well, I got 2 variables and, I'm going to compare the 2. Sometimes that one variable that's in there might automatically influence the results of another variable. So it just kind of changes the whole game a lot, actually. Some researchers have found that it can change it up a lot. So that's kind of your confounding variable. Now, there are different studies as far as, making sure that your results are valid. One of the things that researchers do, including myself, is that we want to make sure that we have a large enough population size. Okay. We kind of talk about that as the power of 100, making sure that your sample size of whatever you're studying is a large group, ideally 100 or more. You don't want to just study 5. Okay. Sometimes it could be pretty difficult because if your study population is really small and you're trying to break down the study population, then, it's not a true sample. It's not representing the population. Okay. Another concept to be mindful of to measure validity is making sure that the results of what you have from one study are similar and consistent to another study. You don't want to go all the way off the cup, but you really want to say, okay, well, this is consistent with this study. So what I found on this end is pretty valid. So those are just the concepts to kind of really measure validity. And it really helps to understand if there are any biases in these groups or in these studies. All right. So when we talk about biases and any active prejudice within these groups, we're going to specifically talk about the Tuskegee syphilis study. Now, maybe some of us have overheard it in terms of the coronavirus. There have been news reports recently that the coronavirus will be ready by Election Day, or that, the first sample of coronavirus is here. We got it, Now, if you do your research, and I'm not going to go dig deep into the Tuskegee syphilis study, it's a study that everybody should be aware of, okay? Because as a result of the Tuskegee syphilis study, we've gotten rules in place like institutional review boards. That's why I said in your research project, I don't want you to study a person, okay? Nobody gets asked any questions. Nobody is interviewed. None of that. Okay. We want to avoid that at all costs because if we don't follow the rules and the guidelines for institutional review boards, I can get sued and the university can get sued, especially if we're studying human subjects. Okay. But maybe on your own, maybe you want to do your own research. By all means, I encourage you. Just be mindful of informed consent. Now, you may or may not have seen this on maybe your PARQ or maybe your physical activity readiness questionnaire, or maybe a medical clearance form. You might see the informed consent form, and sometimes it'll say something as, just so you know, these exercises may lead to XYZ and access to possible death, XY. Yeah. So that's kind of your informed consent. I'll give you another example that's probably a little bit more clear. Okay. 6 years ago, I went bungee jumping with friends in the celebration of a 30th birthday. And they gave me a 3-page packet of informed consent forms. Now, I was already terrified, and they just handed me this packet of informed consent forms. Basically, the informed consent forms lets me know that there is a risk from jumping from the sky. You could be injured, you could break a leg, or you could die. Okay, you can get into an accident, you can splat on the ground, basically. And in the case of that happening, you cannot sue us because we informed you that these are the dangers to you jumping out of the sky at 30,000 feet. So basically, that's what informed consent is, just to be point blank, period. Okay, it's going to lay out those risk factors or what could happen and what may happen, but you agreed to this. Okay, so that's what happened with the Tuskegee syphilis study. The Tuskegee syphilis study started in 1932 in Alabama, where Negro men, in terms of the documents are concerned, we can identify them as black men. As black men were injected with an active form of syphilis. And in that progress or in that transition of getting the active STI of syphilis, they were made some promises that this was going to be immaculate health care, that they will be fine, and just kind of given broken promise, well, not even broken promises that didn't even exist. And basically, of course, 600 men were infected with syphilis. And additionally, these men spread syphilis to their wives and their children, or any other heir that was connected to them. And of course, that accounted for a lot of lives that were lost. Now, again, when we're thinking about coronavirus, and like it could be, it's not one of those things where it's like, okay, well, that's just a black thing. And I don't, I know why black people might have an issue with it. By all means, it's not just that. Okay. That's what makes public health an absolutely wonderful thing. It's very inclusive, and encourages equity. Okay. I've ran into white men who've had this issue, like, I don't know about this vaccine. I'm not feeling it. That's kind of quick for a turnaround of a vaccine. And I ran into white women, same thing, like, I don't know, maybe I should avoid that. That's not really for me. So it's not even more so, okay, well, now granted, it did impact Black families a lot in that time frame within that community in Alabama, and basically as late as 1996. And what I say that is because as a result of a lawsuit, those heirs were compensated as a result of unethical practices. So I highly encourage you to look deep into the Tuskegee syphilis study, just as a reference point, as well as the Nazi experiments on humans. To gain a better understanding as far as testing, experimentation. If you are one of the ones that does decide to get vaccinated for COVID-19, by all means, I want you to thoroughly read your informed consent. Okay. And, just do your research, do the background information about the organization that is administering the vaccine. Do your research on the medical company, the provider that's doing the vaccine. Certainly do your information, do your due diligence. Okay. So that's some of the things that you just need to be mindful of. Additionally, in the early 80s, very early 80s, late 70s, the United States also underwent an AIDS epidemic, where, again, at the time of the start of the AIDS epidemic, it was strictly connected to homosexual men who are minorities. So that being said, of course, we all know now it's not a disease that starts with homosexual men. However, AIDS is something that impacts everybody. So it's more so the transition to, okay, well, we're going to pinpoint this and we're going to say it's that, and that's that, and that we don't have to worry because it's not going to impact anybody else. Okay. I believe off the top of my head, that is a form of xenophobia. So we want to avoid that at all costs. So when you go into your professions, as far as teaching is concerned, as far as physical therapy is concerned, you want to go into your profession as far as treating your patients or your students or your clients, with the most utmost and equitable respect, okay? Meaning that there is equality in the services that you're providing to your student, your patient, and your client. So still moving forward in terms of problems in epidemiology. So there are going to be problems in drug trials, okay? So sometimes drug companies, you need to do research on them. And as I said, as we're kind of finding out more information about a COVID-19 vaccine, it's important for us to do our due diligence and understand what is going on, okay? Me personally, I have been doing a lot of research and just kind of monitoring to see how this vaccine will go. It's to my understanding that it takes more than 18 months to generate a vaccine. So, for example, take the flu vaccine, for example. The second you're getting the flu vaccine, they should be almost done with at least 2 more flu vaccines. Okay, so it's an ongoing process as far as vaccinations are concerned. So always do your due diligence, by all means. Not giving my opinion, trust me, but I want you to form your own to be able to establish, like, I didn't know that. Okay. And it's also good to be mindful of with potential clients and patients. So, we talked about the different weaknesses as far as the major types of epidemiologic studies. But what I will do is that we'll talk a little bit about social math and using data to tell a story. And let me see if I can find these pictures. Hopefully, I can find them. Let's hope I can find these pictures for you. All right. So, as one who is very passionate about the let me see if I can make it bigger. Hopefully I can make it bigger. Maybe not. Nope. I like to make it bigger. There it is. All right. So, as someone who works in public health, as well as exercise science, not only am I passionate about, getting accurate and current health information out there as far as health and wellness and fitness are concerned. But on a strictly public health basis, I'm extremely concerned about the health of Black mothers upon giving birth. Now, you may have seen information through CNN, and again, you could Google it, and I encourage you to Google it actually. So, test question. Yep. So I encourage you to Google what CNN has recently posted about Black women and the care of the care there with certain providers as far as mortality rates. So, off the top of my head, I believe it states that Black women have a higher chances of living through childbirth if their provider is Black. And Black women do not. They some do, but it's been studied that it's there's a higher risk of Black women succumbing to childbirth as a result of they're in a provider outside of someone who is Black. So by all means, I encourage you to look that up. So there are a few things in terms of pregnancy-related deaths. Okay, they talk about preeclampsia, stroke, infection, heart and blood vessel conditions, mental health conditions, hemorrhaging, and like I said, it's a little fuzzy. But this is an example of a little bit of social math. Okay, you're just taking the data that you've collected from epidemiology and then just putting it into something that is very relatable. Okay, someone who is very interested in Black maternal health. One of the things that I'm passionate about is understanding, trying to reduce the cause of stroke, heart and blood conditions such as hypertension, underlying heart diseases, and just working with a woman before she considers childbirth to get her healthy, and then during, while she's pregnant, to maintain her health. So those are just the factors that I am passionate about. Additionally, where the communication comes in is being able to provide the information to other providers, and it could be white, Asian, Hispanic, all other providers across the world, letting them know what are some of the underlying issues as far as Black maternal health is concerned. And that's the other issue with epidemiology. It doesn't always really directly trace the issue. Sometimes it does, but not always. So that's the reason why epidemiology, like anything, because it's made from humans, it's subject to human error. So let me see, showing you let's see if I can get it. Let's hope I can get it. All right, so showing another infographic, okay, and that's really what it is. Once you take data and turn it into something that's real understandable, it's considered an infographic. So, of course, this is just as blurry. So, quote me if I'm wrong. I believe this is the state of Mississippi, okay? Looks as if Mississippi has Yep, it is Mississippi, as blurry as it is. It's a state with the highest amount of Black maternal deaths or mortality rates than any other nation. It does impact the South a lot. Okay. And again, those are just risk factors that I take personally as a Black woman from North Carolina. So those are just things that I like to consider in terms of social math, like something that is relatable and understandable. And I just instantly said, oh, wow, I didn't think about that. If as a Black woman living in the South, I'm at a higher risk of succumbing to childbirth. So it's all about knowing what those risk factors are. So from the other picture, just knowing what some of the risk factors are as a result into maternal death. So, all right. And another topic that I'm very passionate about is the incarceration rates. Okay. Now that this is just an example again of social math. Okay. You just taking the data that's been presented to you and just putting into something that can be relatable and read. As I said, incarceration is important to me as far as ensuring what as a community can we do. And it doesn't matter who's in that community. I could care if, it doesn't matter whether you're black, pink, or blue. Okay. We all can contribute to building a better community, as well as looking towards, as someone who has two black brothers, a stepdad, as far as what are some of the things in the community that would help to reduce the numbers of black men going into the prison system. So, and there's a number of things we all can do. But this is a very passionate topic to me because it is something that has been really going on for centuries. So, but this is just a straight infographic that just kind of lets us know what are the likelihoods as far as broken down into gender and race who enter the prison system. Now, as I said before, we talked about cohorts where you're studied from the start of time and then you're still going to be studying until the end of time or whenever that date changes or that type of thing. So essentially these are cohorts, okay, where maybe this study started, I don't have the dates of it. I think it says 2007. So maybe they were studied at the time they entered the prison system, maybe in 2005. And maybe things like the census was ran. Well, I don't know. I'm trying to think. No, they don't do the census because they don't do census in institutionalized locations. But a study may have been done by maybe the state, the people that fund prisons. So that's where these statistics come from. So, but like I'm going to tell you guys again, I highly encourage you to do your research to any data that is found. Okay. Don't just say, oh, okay, I got it. I'm going to do it. And I encourage you to just really do your research. And I will say this. Now, this is for me, this is social math. You're going to think this is so weird, but this is me. For me, social math is looking at a review of something. So let's say I want to buy something. I do want to buy a new SUV. We're just going to put that in the atmosphere. I want what I think it's a Range Rover. I want a Range Rover Discovery. I think that is the cutest car, okay? Or truck, rather. It's perfect for me. I'm not tall, but it's perfect size, okay? I want I think it's a Range Rover Discovery, okay? So in that Range Rover Discovery, I just want to see, hey, who likes this car? Who's buying this car? So I kind of see just looking at the reviews, like if the reviews are any good, or that kind of gives me an idea of, okay, maybe I can go to this car, or maybe I can go to another truck. Maybe I can consider, you're going to hear me say this. I've always wanted a luxury SUV. Maybe as opposed to a Discovery, maybe I need to go to a Cadillac. So those are just things that I look at as far as data is concerned, looking at the reviews of something. And I also look at how many reviews of something. Now, if I see maybe, the Discovery has 5 reviews or whatever, I'm not gonna lean so much to get that car. I'm not gonna be as inclined to get that truck based off of 5 reviews. But the Cadillac might have 2,000 reviews, and they might be really good reviews. I'm gonna be more inclined to go towards that. So that's just a basic way to kind of start reviewing and assessing data, whether it's valid or not, just by looking at reviews. Okay. You're not going to get something where it's only been reviewed 3 times, or definitely not once. I don't look at anything that's only been reviewed once. So, but you'll definitely look at something that's been reviewed 700 times. So those are just examples of assessing data. Your quiz will be available to you as far as just that information that I went over. This video is probably a little lengthy, so forgive me. Do not forget to go in and complete your task in Module 1 and 2, module 1 and 2, has your information as far as why is public health so controversial. Additionally, in your learning module, it also has a selection of your semester-long project. Okay. If you have not reached out to me about help with your semester-long project, I believe I reached out to maybe 3. Okay, there's still 5 of you that I need to talk to you about your semester-long project. So once you kind of have an idea, ballpark, doesn't have to be specific, it could be ballpark. Okay, once you get into the ballpark region, you're going to come in here and your semester-long project. And I encourage you to, because we're a small group, I encourage you to get in this group and make sure you talk about, hey, some of the things that I'm thinking about. And I mean really engaged. That's the same thing with your discussion post. Really engaged. Don't be, I like this. That's cool. I agree. Don't give me those because you'll lose points. I'm not even going to sugarcoat it. Okay. You engage with your classmates, get involved, help them maybe find an article that you found. Maybe you saw this news article. Maybe you knew somebody who went through that. So those are just things to be mindful of, not only with the selection of your semester long project, but all your discussion posts. Okay. Now, week 3 and week 4, what I want you to do with this specific discussion post, I want you to find kind of a chart like that. Okay. I want you to find an infographic that tells a story that you can relate to. Okay. Don't give me an infographic that just is off the cuff. Okay. And you can't tell me a story behind it. I want you to find it and I want you to figure out a way to how it relates to you closely. Okay. How does this impact you as a person? As I said, I put up the infographic about incarceration because I have 2 younger brothers and I have a stepdad. So those things are very important to me. And maternal health is important to me because again, one day I wouldn't mind becoming a mother. So those are just things to just be mindful of. Okay. So if you have any questions, make sure you send me a remind app. Make sure you let me know of an alternative time by the end of the day tomorrow, because I realize I have a standing 1 o'clock meeting. So just send me a remind app and we'll go from there. Your quiz will be available right after this, right in this section, right below what is social math. Peace.